You've had a very difficult problem all your life. Well, for many, many years. This question of your bad temper, you tend to have little control over it.
A psychiatrist's office in Yorkshire.
I was in the club one night and something started in there. And I just picked up a glass and just stuck it in this woman's face, you know. Before I realised I'd done it, I didn't realise until afterwards that I'd done it, you know.
Yes.
And,
Was she badly cut?
yes.
And then you have attacked people and scratched their face badly, have you not? And rain blows on them?
Yes.
Has your bad temper, your inability to control it, Margaret, got you in trouble with the police
Yes,
before the courts at all?
5 convictions for assault.
You have, I see. Well, it seems to me, Margaret, that since you've been on tablets and pills for years, and you've never really got this major problem in your life under control, it is quite reasonable, very reasonable at this stage, to consider an operation designed to tone down very considerably indeed your aggressive impulses, to eliminate your bad temper.
Will this help me?
Yes, I think it will.
It's just a bit frightening, isn't it?
Well, I suppose all operations are a bit frightening. Some people are more nervous than others, of course.
Margaret is being prepared for an operation that will change her personality.
Find your eyelids getting rather heavy. In a minute you'll go off to sleep. Okay?
In order to control her temper, a piece of brain deep inside her head will be destroyed. The effect will be irreversible and the outcome uncertain. If Margaret is cured, controlling human behaviour by brain surgery will no longer be in the realms of science fiction, but will become a day-to-day reality. This is Margaret's case history, before, during, and after that operation.
I think the important thing is that if we can stop her having these aggressive attacks, I mean, that's obviously a good thing to do. As I've explained, it's not the treatment part of the operation today, it's just the setting up of the apparatus.
But who recommends her
Oh,
to come to you?
Always. I don't know anything about psychiatry. I'm just the surgeon.
When you say just the surgeon, what do you mean by that?
Well, I do the surgical part of it.
But to what extent, and surely there must be some extent, you examine the case of Margaret before you take on the case?
Oh, yes, and it's discussed with the psychiatrist.
But how deeply do you go into it before you actually
I have a
take on the
long...
operation?
They're very highly selected, these patients. I mean, one doesn't sort of operate on any patient that presents with aggression.
So you do have the right to say that an operation is not vital in a particular case?
Oh, indeed, yes.
But you think that it is vital in this case?
Yes, I think she has reached the stage. She's been in a mental hospital for so long. She has reached the stage when surgical treatment is justified.
When there's on animals and everything, they say it's scarf and they say no, they are amusing.
Margaret is 39 and a Yorkshire housewife with 5 children. She awaits the operation in a large mental hospital where she's been a patient for 5 months. She was referred here because she took an overdose of drugs and is presently classified as a manic depressive with a behavioural disorder. Over the last 15 years, she has been here many times and has received electroshock and aversion therapy. She now takes 4 different types of tablet every day, 2 antidepressants and 2 tranquilizers, a routine which has become all too familiar.
Tablets, Margaret.
Oh, I don't have this one at dinner time, love. Where's my agitation tablet?
Which is your agitation tablet?
That big white one.
Yours have been reduced a bit.
All right.
Yes. Jackson.
Jelly tops.
In the enclosed world of the mental hospital, Margaret's protected from the situations most likely to spark off violence.
Well, I feel it in my head. I feel this tension goes right up to the front of my head here. Front of my head and back of my eyes. And it's when that snaps, it feels as though tight bands around my head. And that's when I seem to go off. It's like a band snapping inside me. Inside my head, you know.
And when you become violent, I mean, how violent are you? Are there no holds barred? Would you try and kill somebody?
Well, when I'm mad, I just don't care. I just go mad. You know.
Have you ever reached that point?
Oh, yes. I threw a fella under a gentleman under sorry. I threw a fella under a car, you know, nearly under a car a year ago. And if it hadn't stopped, it was a taxi. He went on the bonnet, you know. But if the taxi hadn't stopped, he'd have gone under the taxi, you know. He wouldn't have had no chance. I once did stab a man in his arm, you know.
And on those two occasions, did you deliberately set out to kill those people?
No, I don't deliberately. No, I don't do it deliberately. It's the state, you know, I've been put into, you know. I don't deliberately try to do it.
But in the case where you stabbed a man, I mean, why did it reach that pitch? What had he done or said to you to make you want to stab him?
Well, I can't remember what he said to me, but, you know, he was insulting me. I had a party on. It was a party at our house. One Christmas it was. And I just picked the knife and stuck it in his arm.
Netta, you've known Margaret for 12 years and been in trouble with her several times. How much of that has been your influence?
I don't actually know. The burglary idea was mine. The violence part, I think, well, Margaret was violent before I met her anyway, actually. But we sort of got onto drugs together and drinking and mixing the drugs with the drink. And that led us to doing more foolisher things than what we've ever done before, you know.
Netta has been Margaret's closest friend and confidant since they've known each other. She's familiar with the kind of situations in which Margaret can break the law, like 7 years ago when they decided to burgle a shop.
It happened we'd taken some amphetamines in the morning, and these have an effect of probably 24 hours, and they make you so full of energy. And we went to this all-night cafe for a drink and listened to some records. We couldn't sleep, and then it suddenly came into... I suggested to Margaret that we went and did a shop. You know, none of us have ever done these things before. This just came to me. Oh, let's go do a shop. So we went to do this shoe shop on the main road. Well, I said to Margaret, we'll count to 3 and I'll throw the brick and you'll get the things. So we counted to 3 and we both at one window, Margaret at one window and me at the other window. It was a double-windowed shop, you know. We both count to 3 and throw the brick at the same time.
Both Netta and Margaret were arrested and medically examined. They were found guilty of the burglary and only discharged on condition they spent a year in the mental hospital and received aversion therapy to the drugs they had been taking. But when they came out, their lifestyle hadn't altered.
You know, we went out every single night. We went out dinner times, from the night to the nightclubs. Back again at dinner times, nightclubs. This went on for weeks.
I mean, did you drink a lot?
Yes, yes.
And you were taking drugs as well?
No, not then. We'd had aversion therapy, so we turned to drink. We started to drink excessively, you know, really. Looking back now, I don't know how we kept up the pace.
Gillian! 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 I was always off when the tea starts.
In spite of all the trouble and violence, Margaret, on her own, has managed to bring up 5 children. Bruce, the eldest son, is married. Carol is closest to Margaret and looked after the younger ones while her mother was in hospital. On the Sunday before the operation, they can all look back with humour at Margaret's unpredictable behaviour.
Come here. Come here and give a hand in the kitchen. No, it's all right, we don't want to do something. No, you can't have a drink of pop. Put it down.
That's for Sharon. Sharon wanted that.
Have you known your mother come into the kitchen and break things and really take it out on herself?
When everybody gets shouting and bawling at her, she comes and she just starts swearing in that lot and just tips all the table up. She just wipes her hand clean across them and everything falls off.
How do you handle her when she's like that?
Everybody's frightened to death. They just sit there. Can't do no really. Nobody dare go near her. They just sit quiet. We know that she won't hurt us really. No, we know that she won't hurt us at all. But it's just seeing her like she is. It frightens you, you know. I remember one time at Christmas, it was Christmas Day, she'd been cooking the Christmas dinner, and Bruce brought a girlfriend home, and nobody bothered to help her, you see, cooking the dinner. And we were all sat down to his dinner, she'd been doing it all morning, and our Summer sat there and she said, those potatoes are a bit burnt. My mum jumped up and she chased her all around the room, and she didn't have to, where she got her. Just was saying the potatoes were burnt.
Very much.
Have you done that, son? I'm just going to go back to sleep.
Did you have...
Come on, give us a light.
I've got it.
No, I haven't.
I've done it.
Have you done it?
Did you have any trouble with Bruce, Margaret?
Oh, our Bruce, he used to be a right devil. I mean, he's married now. I haven't seen much of him. Well, I do see plenty of him. But I remember one tea time he wanted to go somewhere. And I told him he couldn't go. And he said he were going. I said, oh no, you're not going. And the handle was broken in the door. And it was broken on the outside, you know. You could open it on the outside, but you couldn't on the inside. And he flew out the door and closed the door, bringing the handle with him. And I was that mad, I just put my hand through the window to grab him back, but he'd gone, you know. Just like that. So our Bruce was pretty hard, you know.
Yeah. Sandra, 4, 5, 6, 7. How many instead of a spoon? Oh, thank God.
What did you feel inside when you got one of your depressions?
Oh, I used to feel ill.
7.
I do feel ill when I'm depressed. I really feel ill. I just want to be left alone and I just want to go to sleep all the time. And I can't even stand to hear the kids' voices. I can't stand to hear them. I'm hoping that this operation, you know, helps me to cope with life a lot better, you know.
But the operation is to get rid of your aggressiveness, isn't it?
Yeah, I've seen it lots of times.
Well, what about your depressions? I mean, it sounds as though you make yourself ill through your depressions. Is that right?
Yes, but the doctor told me that this will help me depression. It'll help me to cope with things better, you know. I hope it does, you know. I'll be disappointed if it doesn't.
The main object of the operation is to implant little nylon balls underneath the skin of your head, underneath the scalp. And the incision that's made for that is behind your hairline, so that when your hair grows again, the scar will be invisible. The nylon balls have little holes made in them so that electrodes and needles and whatnot can be pushed down in a certain direction. During the second part of the operation, you will be wide awake. You'll be a little bit doped just to make you care a bit less about what is going on. And that is the actual treatment part. You're certainly going to be frightened. In fact, there are going to be 2 frightened people on the end of the needle. I'm going to be frightened and you're going to be frightened. But I mean, that's that is part of that is what the operation consists of. And this may have to be done more than once.
And what are my chances, you know, of success, of the operation being a success?
Well, we have only done this operation 6 times previously, and the results are extremely good.
Yeah.
So the chances are high. I mean, it's part of a surgeon's job, is it not, to balance the risks of an operation against the risks of doing nothing. Now, if we leave you as you are and don't do anything, then you're not going to spend a month, a year in a mental hospital, which you are doing at the moment. The time spent in a mental hospital is gradually going to go on increasing, and you're going to end up there. And you're only 41 years old now. You've another 40 years to live. So we're forever balancing the risks of an operation against the risks to the patient of not doing the operation. What is going to happen to the patient if we don't do the operation? And
Yeah,
on balance, I would advise that we do the operation.
Yeah.
When I was younger, you know, my mum didn't have much, and she took our Julian into town for a pair of trousers. And she came home and they cut the gas off. Then as soon as she got home, you know, she found out they cut the gas off from outside. She wasn't going to leave the house because of them cutting it off, but she never thought of them cutting it off from outside, you know. Anyway, she took us all over to this woman's over at road. I don't know how she did it, because she always had her gas and electric cut off. She had 4 or 5 boys. And she always had hers cut off, but this particular time she'd got hers on. And they let us stay there, because her mum wouldn't let us stay at home, because she wanted us to get cooked meals down us and that. And my mum didn't eat anything for ages. She used to bake a lot then. She used to be like domesticated then. And she did all cooking for our family and that lot. She went on hunger strike until they put it back on. And I felt dead sorry for her then, because I knew when she used to be baking, she used to be dying for something to eat and she wouldn't touch anything. And she used to sit there saying never to, you know, and she never did do. And I felt dead sorry for her then. Another time, she wrote this manuscript, I think they call it, on a life story, you know. This was only last year when she showed me it. She'd had it knocking about the house, but she'd never shown anybody it. She'd never shown me any of her family it. And I was sat in with her one night. She was a bit depressed and she told me to read it. And I couldn't stop crying all night after I'd read it.
Margaret's life story, written in hospital, tells of an unhappy childhood in an orphanage and her struggle to raise a family after a broken marriage. Here are the opening lines.
Maybe when I can find my true self, half my battle will be won. What I want to find out is who I really am and what it is I really want out of life. Sometimes I wonder if that is too much to ask, and I must go on forever living a false life, pretending to be someone that I'm not. And I must be determined to get better and come to terms with myself for the sake of my 5 children, whom I love so very much. I know myself I'm hurting them all the time.
Well, now, this is half a human brain. The older parts of the brain are here, in this area. And this area here is the thalamus, which is a relay center, really, for sensations coming in. And below the thalamus is the hypothalamus here, which is an area about 15 millimeters from top to bottom, 15 millimeters from front to back, and about 10 millimeters from side to side. The part of the hypothalamus which is destroyed in this particular operation is the posteromedial part, which is in that area there.
The day before the first part of the operation, and Margaret prepares for hospital. In spite of all the trouble, she can still remember happier times as a sales representative with a cosmetics firm.
When I worked for Vanda, and I was always the top saleswoman, you know, I felt good, you know, I felt real. Everybody saying, Margaret, how do you do it, how do you do it, you know? How do you get all these sales, you know? I used to feel good then, you know, at the seminars, when they used to come from all over, you know, and I was the star saleswoman, you know. I feel good when I see all my children looking nice and well-groomed, you know. I feel proud of them. I don't think there's anything else, really, you know.
And when you're feeling as good as that when you worked for that cosmetic firm, how does that contrast with the sort of drudgery of looking after the children here?
Well, I'm usually happy, you see, when I work with Vanda. And the children don't seem to get on top of me. You know, instead of going out drinking, I'm going out selling, you know. And I'm happy in my work and what I'm doing.
What other things make you feel good and give you satisfaction?
If somebody's aggravated me, you know, to such a point. I mean, some people, you know, have really upset me, you know, and I've sort of waited and waited, you know. And when I have got them, then, you know, I've given them a right good smack, you know, and it's made me feel good, you know. I think I've waited ages for that, you know. And that makes me feel good. When I feel I've smacked somebody I really don't like.
When you say it makes you feel good, I mean, how do you feel? Do you
Well,
feel better than the other person?
Yeah, I feel good. You know, I'm right glad I've done it.
But do you feel superior to them?
Yeah.
In what way?
I know then they're going to leave me alone, you know. They won't bother me no more.
Flexed her cervical spine more. That's better.
Now then, all down together, slowly down together. That doesn't look far off.
Try on doing that, but otherwise it's going to stick through the gall.
Okay, shall we start tightening him in?
For this first part of the operation, Margaret is unconscious.
You want her further forward, Mike. She is now tilted like that and should be like that. That's perfect. Screw on.
Contact made. Contact.
Yeah, contact me.
Screw on, screw them right in.
Each human brain is different, and the first priority is to determine where the hypothalamus is inside Margaret's head. While she is under anaesthetic, a clamp is set up to act as a reference point. Long probes, which will eventually accurately destroy the tissue, can then be aligned in the right direction. X-rays are taken at right angles to each other, and these give a three-dimensional picture of the skull. The neurosurgeon can now plot the exact position of the hypothalamus with reference to the clamp, and can work out where to point the probes.
Coordinates are there, and I've done the offset.
Yeah, that's ACPC. You've got
It's 1.65.
the midpoint of that it is.
And this is going to fit onto here.
A variable bridge is positioned at the correct angle so that the probes will be in the right plane.
Dirty up to there. Dirty up to there. You got the bottom wells, please.
Slider.
John, can you do this moving then? Can I have a...
Two holes have already been drilled in Margaret's head, and in these will be fitted nylon balls, through which the probes will run.
Leave it like that, John, for the moment. Lock, please. I'll get some stuff properly around it. Hold that, please. Give me that.
The nylon balls are to be cemented into the skull so that their position is fixed, and the guide holes they contain will point towards the target on each side of the head.
God, it's difficult. I knew it wasn't my day when I got up this morning. Yeah, well, if it were easy, she could do it herself, couldn't she? I tell you, it's not our day. add some, yeah.
The accuracy and success of the second operation depends on getting the small nylon balls firmly fixed and guiding the probe towards the hypothalamus.
Oh. No. Undo that screw, will you, please? This one? You, yeah.
This preliminary operation takes about 4 hours, and to allow the cement to set, the second operation is not performed for another week.
Now, you can see the 2 balls there. They are fixed relative to the patient's skull. The centre hole of each of those balls, that one and that one, guide the electrode in a certain direction in 3 dimensions to the target and in fact through the target. And all I've got to do now is measure the actual distance from the surface of that to the target. I've got the direction fixed. I merely now want to know the distance.
Have you got any TBA 990 Qs?
No, they're on the way in, Adrian.
While Margaret waits in hospital, her friends speculate on the outcome. Daisy has known the family now for 11 years and on several occasions took care of some of Margaret's children.
Did she ever in fact hit the children?
Very rarely. Very rarely. This is why I say, was she a violent person? Surely a violent person takes it out on whoever's near them. I never knew Margaret. She would give them the odd cuff, as you would a child, but she certainly was not violent with the children, ever. She was not violent with the children. That is absolutely true. She never was violent
So
with the children.
why do you question whether she was a violent person?
I question whether she was a violent person because, as I say, she never hit the children. She never... most of our violence seemed to me to be a deliberate violence. She went down, I remember at one period, down to the National Assistance and sort of half wrecked the place and got a grant for clothes. So she tried again, and then it became a vicious circle. She got a reputation as a violent person, so when she went in anywhere, immediately people said, look, you know who that is. And then that caused violence, and the thing was a complete vicious circle. The violence was causing the violence, because she'd now got this name for violence.
Could she have pulled herself together then, do you think? I mean,
well, it's no good saying to someone like that, pull yourself together. If they could, they would. If the person is that type of person, and her nickname is Can't Cope Margaret, if you're the type of person that can't cope, it's no damn good going up and saying, pull yourself together. They can't. They would if they could. They wouldn't live like Margaret lived if they could pull themselves together. But Margaret was all right, if you like. She's a bit of a weak person. Call it, blame it on her child, or blame it on what you like. She's a very unstable person. No damn good saying to Margaret, pull yourself together. If she can't, she can't. And she couldn't. Half of Margaret's trouble was that she set off with the idea that she would be eternally 25. She could get the men, she was attractive. The years were going by and she saw a blank in front of her. From the children being, say, 3, 4, 5, her whole point of conversation was, when they're grown up, it will be real. I'll only have myself to think about. As they're growing up and leaving me. What am I going to do now?
Do you think she's deserved what she has got out of life? Do you think she could have prevented it?
Whether she could prevent it or whether she was this type of person and it would have happened to her anyhow. As I say, don't run away with the idea that Margaret wanted a normal life. She didn't. Margaret wants the excitement, the glad. She will try anything. 99 people that you went to and said, will you have this operation on your nut, would have said no. But Margaret would say yes. If you'd asked Margaret to have an operation on anything from a big toenail to a brain, she'd have gone. If you ask Margaret to do it, she won't fly, that's one thing she won't do. But, I mean, Margaret will have try any relationship and try anything. So, whatever else she's got guts. She's not afraid of life.
Can I ask you, do you yourself, as a surgeon, know a lot about psychiatry?
No.
Do you think you should know more?
Oh, yes, I think I should know more about lots of things,
But I mean, is it necessary for the job that you do? Why not?
Well, if a neurosurgeon, he picks up a bit of psychiatry or psychiatric knowledge, obviously, as he goes along. And if he's got what could best be described as trusted psychiatrists sending him patients, then one puts one's faith in the psychiatrist.
But do you put total faith? Because in a sense, it is an imprecise side of medicine, isn't it? No two psychiatrists really agree totally.
Well, that's a bit of an exaggeration. I mean, most psychiatrists surely would agree that, in fact, I'm quite sure they would, that the patients on whom I've operated already are aggressive or have outbursts of aggression.
But there are degrees of aggression.
Oh, yes, yes. It is imprecise, if you like, yes, I would agree.
And it's also, you have told us already, it's a simple operation.
Yes.
I mean, when you say simple, how simple?
Well, you could teach a newly qualified house surgeon how to do it in about a fortnight, I would reckon. Nothing very difficult about it.
So in a sense...
It's precise, but it's very simple to do.
So in a sense, you do a precise, simple operation, and yet you have imprecision among the psychiatrists with the best will in the world.
Yes.
In other words, it's possible that you're getting a misdiagnosis.
Well, you take by any doctor. Yes, of course I can.
But you take over at one point and you take a set of facts and do a simple operation.
Yes, well, this is my faith in a particular psychiatrist, surely. In other words, choose your psychiatrist.
So do you think Margaret has been diagnosed correctly?
Yes.
And is it going to be a successful operation?
I don't know. I hope it will be.
Well, good luck.
Otherwise I wouldn't be doing it. I'll certainly need the good luck.
I felt a big jerk.
Well, a jerk of what?
A jerk. My own body jerked. I just felt as though I was going to fall off the floor.
During most of the second operation, Margaret is conscious so that the neurosurgeon can observe her reactions.
Hey, can you put your head straight, or is it beastly uncomfortable? Can you put your head straight? That's right. Northwest, actually, of the centre hole.
In order to find the exact area of the hypothalamus to destroy, a search electrode is pushed through a guide hole.
15.
Go again.
The electrode is attached to the electricity supply, and the current is switched on, stimulating the area at the bottom of the electrode.
Got you, Margaret. I'm sorry I had to do that.
Yeah, why did you have to do that?
I went all funny and all.
Did you?
My head all shook inside.
Oh, dear.
All my head shook inside.
Yes, all right.
Everything shook. My eyes, everything, my teeth.
Oh, that's wrong one, isn't it?
Oh, hairs left.
Yes, that's all right.
Oh, that was frightening.
Yes, I'm sorry about that.
Everything was frightening, but that was more frightening.
Yes, just lie quite still now.
Don't do it again.
No, I won't do it again.
The neurosurgeon is looking for a response of fear, for this is an area closely related to anger. He now tries the next guide hole, looking for a stronger response.
Look up to the ceiling. What did you feel then? Yes, now can you better describe it? Can you describe it any better?
I'll try.
What did you actually feel?
A red thing.
A red thing coming towards you.
Yes.
Can you go...
In this way, a number of guide holes are tried.
Keep looking up. Keep looking up. Look up.
Please, I'm frightened.
All right, you're all right, Margaret. You're doing very, very well. Now, what do you mean when you say you were frightened?
I'm sorry.
No, but try and describe it. I'm not doing anything at the moment except sitting here talking to
As soon
you.
as it sounds, I can't describe it.
It was just a horrible feeling, was it? But it's gone now, has it?
I shut my eyes now.
Yes. You can scratch your nose if you want to, but don't bring your hand onto your forehead.
I shut my eyes now and it's red and green. There's green in the middle and all red round the side.
As well as Margaret's verbal response, the neurosurgeon is also looking for an increase in her blood pressure and an enlargement of her pupil size. As he tries again, this is the moment he's been waiting for.
Keep looking up.
I'm frightened.
Yes, keep looking up. Look up.
The pupil size has greatly enlarged, and this, along with the reaction of fear, are the desired responses.
That wants to be recorded, please.
I'm terribly sorry, I'm frightened.
No, you're all right now.
I really am.
We won't be long, actually.
Just give me a rest. I'll be all right.
All right, we'll both have a rest. You have a rest and I'll have a rest. Pupillary dilatation then appeared.
Having found the right position in the hypothalamus, Margaret is now sedated and preparations are made for the final stage.
Yeah, no, to worry about it.
A new electrode is put in the correct position, and to this will be attached a much larger current, which causes the tip of the electrode to heat up. The brain tissue is literally burned out.
All right, it's just my hand resting on it.
To an outsider, that operation really looked horrific. You know, it sort of had overtones of Frankenstein to a complete layman.
Yeah.
Did it have to? Was it distressing for Margaret?
Yes, I mean, she was under a fair amount of tension, obviously, but she was given some injection by the anaesthetist to keep her fairly quiet.
Why did she have to be conscious?
Because we were using the dilatation of the pupils and her reaction as to whether the electrodes were in the right place.
So what reaction were you exactly looking for?
Well, the one that was best seen was dilatation of the pupil and increase of her pulse rate.
What did dilatation of the pupil mean to
Well,
you?
the black part of the eye was becoming wide.
Yes, but what did that indicate to you?
It indicated that the electrode was in the right place. And therefore, that is the part that we were going to coagulate or destroy, which we did.
The right place being that part of the hypothalamus where her aggression centre is?
If you can put it as crudely as that, yeah.
Well, how should I put it?
I don't know, but not like that. I mean, there's no such thing as an aggression centre. But that is the part, the part of the hypothalamus, stimulation of which produces an increase of pulse rate and an elevation of blood pressure and pupillary dilatation, is the part of the hypothalamus to be destroyed. So if that is your aggression centre, yes.
So what happens when someone gets angry? What happens in the brain?
I don't know.
What are the processes then that make him show anger?
No, those are two different questions, aren't they? He shows anger, presumably because he either sees something which has made him angry or hears something which is making him angry. There is then an emotion built up, which is a thought process. And then he expresses that anger, which is again partly an involuntary process of his pulse rate going up and so forth, and partly a voluntary process of kicking the other chap in the teeth as a result of his anger. So that all levels of brain are involved. The parts which are under his control, he's going to sock him one, and parts which are not under his control, such as his rise of blood pressure and rise of pulse rate.
Can you clinically explain why I, for instance, being a relatively mild person, don't strike out and another person will strike out?
No. Not in the same circumstances. You mean two different reactions from two different people irritated by the same thing or the same situation. No, I don't know why different people behave differently.
Do you, in fact, when you make the lesion, do you take away the patient's outlet for anger?
Well, perhaps that would be best explained by saying to you what the patients say to me afterwards. I say to them, what do you feel now, after the operation, if you are faced with a situation such as before the operation you would have knifed the person or gone for him with a broken bottle. And the patient now says, I still feel angry. I still feel as if I want to do this, but I no longer do it. Now, whether that is it is destruction, it is a destructive lesion. So some outflow from the hypothalamus, so to speak, has been destroyed. Presumably, therefore, more volitional activity, more voluntary activity comes in and takes over. The patient still has the emotion of being angry, but no longer reacts to it with arms and legs as he or she would have done before.
It's very difficult to understand how you can take away the hyperactivity, the over-aggression, without taking away the entire aggression. Can you possibly explain it?
No, I can't explain it.
Three months later, Margaret is back home, facing up to the realities of supporting herself and her two remaining children still at home, and coming to terms with her new life.
You know, I feel as though all the zing's gone out of me, you know, all the excitement's gone out of me, you know. I can't seem to converse the way I used to converse, you know. I seem to just be half dead all the time, you know.
But does it worry you that the fight's gone out of you?
In a way it does, and in a way it doesn't, you know. It worries me when it comes to standing up for kids and that, you know. Fighting for kids and that, you know.
Why?
Well, I just don't feel as if I've got anything left in me, you know, no oil in my lamp, you might say, I don't know. I'd just rather go to sleep and sleep it, you know, sleep it off. I'm not, since I've been home, I haven't found myself shouting and bawling at the children like I usually do, you know. I'm just not bothered, I just sort of, I'm a lot quieter, definitely a lot quieter.
But isn't that a good thing, that you're now quiet and you're not going out fighting and hitting people?
Oh, yeah, it's a good thing, yeah. But I mean, it's feeling different, you know.
Is your mum different after the operation?
Yeah, she's worse. Don't like her. I mean, I like her, but I mean, don't like how that's turned out.
Well, tell me, in what way?
I told you a minute ago, that's where she says horrible things, you know, and she explodes now. She says right horrible things that she regrets afterwards, and they are horrible things and all, but... And she thinks none of her kids care about her, and that's all she thinks. She just sits thinking all day, getting depressed and getting upset. And I think her temper's worse now. It's just that she can't calm it down in any way. She just shouts and shouts. Like before, when she used to get a temper, it was just she just put her fist through the window and she was all right then. Her eyes are bobbing. And she doesn't seem to know anybody now, you know. She seems to be on her own. She seems to be alone all the time. She can't converse. She's lost all her personality. She used to be bubbling with it before. She can't converse with people now. She never knows what to say.
9 months after the operation, Margaret seems to have improved greatly and is even thinking of marrying again.
Come in. Now, hello, Margaret. Come and sit down. You're looking very cheerful.
I feel it, you know. I feel well.
Now, I've just been going through your notes. It's about 9 months, isn't it, since the operation?
Yes.
So what do you feel? Do you feel any different?
Oh, I feel really well, you know.
Yes, but in what way do you feel different since the operation?
I feel as I can cope with things much better without,
Yeah.
you know, getting aggressive and blowing off steam.
Do you think now, Margaret, that in any way you're rather a sort of cabbage?
Oh, no. I think I'm more rational. I can still lose my temper, you know, but not violently and not without reason, you know. But I'm not violent.
And what drugs are you having now, Margaret?
Nothing.
Nothing?
No sleeping tablets, no tranquilizers, no antidepressants, no pep pills, no nothing.
And what about your drinking habits? Are they the same as they were
down.
before?
No, I've cut down on my drinking. I take a drink at weekends, you know. Friday nights, Saturday nights, come Sunday lunch, you know.
Well, I think you've done very well, Margaret, so we'll see you again in about 3 months' time. All right?
Right. Right, Doc.
Right-ho, bye-bye.
Thanks very much.
How do you feel now?
Well, I won't look back. I feel as I've been reborn. I do, honest, you know. I really feel great.
Do you ever feel angry?
Oh, well, I'm forced to get angry sometimes, you know, but I don't. I'm more rational than what I was before. I was irrational before. I'm more rational now.
Do you ever feel that you want to be violent, you want to hit anybody?
No, I don't think I do. In fact, it frightens me now. But I still get strung up, you know. But I don't feel violent with it.
But surely there must be a point where if you still feel angry, you can get angry, can't you?
Yeah.
You might want to hit anybody. You might want to hit somebody.
I suppose I do feel a bit like that sometimes. But then again, I'm more, as I say, I'm more rational now. I think, you know, and I just don't want to know. I just don't want to be involved in violence. I mean, I went out over Christmas. And since then, and I've seen that, and I think violence, and I think, good God, is that what I used to be like, you know? And it just makes me shudder.
If her violence stemmed so much from her social background, if she was in a different set of circumstances, she might not have needed the operation.
Oh, that's a possibility. That's a possibility.
So it's therefore also a possibility that the operation wouldn't have been necessary had she lived in different circumstances.
Well, that is possible. I'm not saying it's probable. That is possible.
In other words, she wasn't born to be violent.
I don't know.
There must be thousands of people like Margaret.
I expect there are, yeah.
And so it's desirable then, is it, from your point of view, to change all those people?
It would be desirable. I don't know whether your assessment of the numbers is correct, although I just agreed with it. It would be desirable, I think, for any society to convert its aggressive people, provided you don't interfere, for example, with their intellect, into non-aggressive people. Don't you think this is a good thing?
So you could go into the jails and do the operation on all the violent prisoners.
Yes, and make them better.
Yes, all
Very
right.
darn good thing.
Very good thing.
Yeah,
so that
I think so.
So that there's no violence at all in the world, if you like.
Ah,
it could
no,
be done.
no, you're generalising too much, but no violence in the world. But I still maintain that if you could convert by a relatively simple operation such as this, you could convert a violent criminal into somebody who would fit in and become a normal person, that would be a good thing.
And would you like to see that happen then?
I'd like to see attempts made that way, yes.
And that, we thought, was the end of the story. But just a few days ago, there was an incident which revived unpleasant memories and undermined Margaret's own self-confidence.
Well, I got up Saturday morning and things didn't seem to go right from waking up. I felt agitated and moody, you know. Then things didn't help, you know, with this fella, you know, I'm fond of, you know. Things I don't think he felt really good, you know. And as the day went by, you know, things seemed to get steamed up a bit, you know, hot enough a bit. He went, and then he just walked out, you know. So I went down to the pub an hour later, an hour or two later. I had a go with him in there. I went for him, you know, with my handbag, I just went for him. And then as the evening, we went out and about. And as the evening went on, the aggro was getting worse, you know. And then we came back on the bus. And I just felt it got to the pitch, you know, I could feel this tightening at the back of my eyes, you know. I've never had it since I've had the operation, what I had before. I never had it since. And this tightening just came at the back of my eyes. And I just wanted to hurt him, you know. And if I'd have had a knife on me, I would have... There wouldn't have been no ifs and buts about it. I'd have just stuck it in him. I just really felt like that, you know. I've not experienced that since before I had the operation.
Did you really have a go at him, though?
Oh, yeah, I got his cheeks, you know, and I wanted to claw at his cheeks, you know, and then I think I just pinched him, you know, I squeezed him, you know, on his face. And then I walked away and I went back and I gave him another smack, you know, and then I just got off the bus and it seemed to pass over, you know. It just passed over then, you know. I don't like that feeling. No, I don't like that feeling at all. I like to know that I can stand my own ground, but without that feeling, I didn't like that feeling come over me Saturday night. Not where the tightness at the back of my eyes, like that tight band, you know, around. Because it feels as though it just tightens and tightens, you know. And then something just snaps, you know. It must be the band, I don't know, it must be the... Because as soon as I've got it off me, I'm all right.
Yeah, but did it worry you after all this time, 9 months having that operation?
Well, it's
you can still get that
It worried me to the extent afterwards, you know. Well, could I have done it? Was I capable of doing it? You know, if I'd have had something in my hands, you know. If I'd have had something in my bag, would I have used it, you know? Because, I mean, before I have done, you know. Well, I've smashed anything that's been around, you know, and smashed it at people.
And had you had a knife, you would have used it?
I really felt as though I would have done. You know, if I had, I don't know whether I would have done. I might have held back, you know. I just felt as though I could have stuck a knife through him. That's just how I felt, as though I could have stuck a knife through him. Not as how I felt. It's frightening afterwards. When you come round, you know, like, oh, thank God, you know, I don't carry anything about with me now, you know.
Open your mouth. Open your mouth for me. Good girl. Open up again. That's fine. All right? Can we get a towel, kid?